The differences in training and becoming a CRNA versus physician anesthesiologist are a key part of what sets these two jobs apart. In order to become a CRNA, you need your Bachelor of Science in Nursing. After that, you need experience in critical care. Most schools require 2 or more years of ICU experience. There are some exceptions where you can get in with 1. Then you go on to get your doctorate degree in nurse anesthesiology. These are 3-year full-time programs. Your focus will be on your classroom training and spending clinical hours in the operating room. After you graduate, you have to take the boards exam and be CRNA, and then you are able to practice as a CRNA. So the shortest this route could in theory take you, if you went straight from high school and had the minimum number of ICU experience required to get in, let's say you applied at the 1-year mark and started at the 2-year mark, would be 9 years after you graduate high school. In order to become a physician anesthesiologist, you need 4 years of undergraduate. Your degree can be in anything as long as you're getting your pre-med requirements done and take the MCAT. 4 years of medical school after that. Then your anesthesiology residency is going to be 4 years total. There's 1 intern year in either surgery or medicine. There's also some programs around the country that have anesthesiology specific intern years that are kind of a hybrid of multiple specialties. And then 3 years of your clinical anesthesia year, your CA1, CA2, CA3 years. And after that, you are a physician anesthesiologist. You technically do not have to be board certified, but it is recommended, and most places will want you to be board certified to practice as a physician anesthesiologist. And most people who graduate today do in fact take their boards exams. It's pretty rare not to see that. These fellowship trainings is a major point in which these two professions begin to look extremely different. Physicians have the option of going on to a critical care fellowship year where they could become doctors in ICUs. CRNAs do not have that option. We don't have like hybrid NP roles. There's other fellowship programs that physicians can go into in order to subspecialize or do more research in a certain area, but a lot of those specialties are places where CRNAs practice too. Pain is a very interesting place where typically only physicians have been seen doing outpatient pain management, but there are certain states in the country that allow CRNAs to do this as well. And there are fellowship programs for that too. In my opinion, one of the main benefits of going the physician route is you're never going to have practice restrictions like CRNAs sometimes do. But a major downside is just because you go to med school doesn't mean you'll get to match into anesthesiology. So ask yourself, if I can't get into anesthesia, are there other kinds of medicine I'd want to do? CRNA school is extremely competitive as well. So ask yourself, are you okay with other options in nursing? If the only thing you care about is doing anesthesia, in my opinion, becoming a CRNA makes more sense. But if it's more important for you to be a doctor, go to medical school.